Okay, we are being recorded. It is now Wednesday morning, and welcome to everybody. This is the second in a five-part series entitled Welcome to the New World 2021. I'd ask that everybody would mute themselves until, except for the speaker. We are going to be taking questions in the chat room. I had asked for questions to be submitted prior to this meeting, but if you have any other questions, certainly put it in the chat room and feel free to put your contact information in the chat room as well. We would like to welcome Dr. Ellsworth, Jonathan from Garnet Health, and Alan and the rest of our wonderful board, Joan Patterson. Thank you all for being here and for agreeing to participate. I'd like to introduce Joan Patterson. Joan, would you like to go first and talk to us about health during this wonderful pandemic?
Sure, good morning. So I'm going to share my screen. Again, my name is Joan Patterson, and I'm the Operations Director at Crystal Run Healthcare in Rock Hill. And I'm in my 10th year, or as my husband would like to call it, a decade. So that really ages me. So thank you for the opportunity to present Jamie. So here we go. So just a quick overview on Crystal Run in the event anyone is unfamiliar, and that's why I put a few background slides in. So we're a physician-led multi-specialty group in New York State, founded in 1996, celebrating our 25th year this year. You may have heard the commercials from Dr. Teitelbaum. There's also a YouTube a video, it's under 5 minutes, that you could watch as well. 400 plus providers, 50 plus specialties, 18 plus locations, which is a slight dip. 350 distinct patients, over 1.9 million visits a year, 60,000 COVID tests, over 10,000 positive, and it's across the region because we have patients that come to us from Pennsylvania and other areas. 10,000 COVID antibody tests, outpatient medical services, inpatient medical services. We have skilled nursing facility services, affiliation with ASC, Montefiore Health System, urgent care, diagnostic imaging, sleep center, which is the only one in Rock Hill, and high complexity lab and pathology. And we're an early adopter in the EHR. We use NextGen, and that's been for at least 20 years. Where are we? We're pretty spread out over 3 counties. We did have an office in a small office in Ulster, which is no longer in existence, and also Manhattan, but we're predominantly in Orange County, Rockland, and Sullivan. So the size and scope of the Rock Hill location. We're the second largest Crystal Run healthcare building in the practice. A lot of people don't know this, close to 80,000 square feet. And one of the 3 legacy buildings. Legacy is a nice way of saying we're older, as opposed to the lean sites, which are the Monroe, Newburgh, and West Nyack offices. So the legacy buildings are Rock Hill 155 and the 9 to 5 building. We serve over 40,000 distinct patients and over 190,000 encounters per year, including urgent care, over 31 specialties and services, and as mentioned previously, the only sleep center, 200 plus employees, and 80 plus provider access, because some of our providers do travel from other areas to provide specialty services in Sullivan. And we're one of the largest private sector employers in the region. This is a picture of our Rock Hill endoscopy suite, opened in August of 2019. And if you were one of the early patients, you may have seen me or had the pleasure of an IV stick. Guiding principles, again, just to refocus on why we're here today. safe customers, safe staff, and I added the self-care portion of it, which I know is down the road another topic on wellness that you'll be elaborating more on. And using evidence and science, CDC, Department of Health, or Public Health, our very own, and World Health Organization, where feasible to drive our decisions. I added the Krista Run Healthcare link. It may not work, but please feel free to go to our website. We've had a lot of questions about vaccine access, and that's one way to sign up, give us permission to reach you once we have it. We have been approved for large sites. We do not have it yet, so please feel free to take advantage of getting it wherever you can. Personally, I've been pretty open about receiving mine at Garnet Catskills. I had a great experience, and I've had my second dose already on the 3rd of February, and I'm still doing well, I think. So any mishaps in this presentation, I will completely put on the on Boomer. No, I did great. So our message is to patients to please, yes, please take advantage of wherever you can get it. And Dr. Teitelbaum, I'd be remiss if I didn't mention that he, we recently talked about vaccine advocacy for ambulatory services, and he had an article in this Saturday's Time Herald Record where he and other providers and are advocating for just that. So guiding principles for patients and customers. Again, this felt like going down memory lane, as I mentioned earlier off the recording. This is just a reflection of the many phases of what we went through to get to where we are right now. Many of us may have remembered the last time we shook hands with someone or when we first elbowed. I certainly do. It was that weekend of March 7th, 8th. My son was up visiting with the grandbaby, and I elbowed somebody and they looked at me odd. And, because we were hearing these things on the news already. So we had to pivot quickly. So the scenario I would like to paint for you before I go through this laundry list, which is a short list, is imagine if you had you oversaw a building with upwards of 1,000 patients coming in a day, a very high number. We can drop to lows as well. And you were told you have to manage that without patients coming into your waiting room, like now. That's the tears. We're like, how are we going to do this? So we started with phone triage, pre-schedules, signs. And I told people I am proficient in sign language because most of the signs you saw in the building, I was running around putting up every day or changing or adding, bigger, smaller. The COVID hotline, I know it was painful at times because where is it going? Who's answering? If we had the inherent issues with the communication team being able to handle volume before, well, try having that being amplified. So it was strategized that across the practice, the larger sites had dedicated numbers. So we had dedicated numbers for each large building. We had people literally giving out strips of paper. Please, this is what you need to do. Staff jumping in to screen at the doors. We created outdoor, indoor sick visits. An early dedicated site was Goshen. The Goshen office in Orange County was literally evacuated from the other services and dedicated to screening, provider-led, including Dr. Teitelbaum, Dr. Nasser, Dr. Spencer. So that was just really being able to pivot, think quickly, and implement access for our patients and our customers. The medical greeter came afterwards. Some buildings had somebody sooner, but again, this is a new position dedicated for the front because we were all taking turns. Somebody said, Joan, every time I come to Krista Run, I see you at the door. That was part of it. Which also we implemented the thermal imaging. And again, some offices had it sooner. So if you thought, oh, geez, I went to Middle Orange County and they had it, why don't you have it in Orange County? That was all evolving. The environmental controls, cleanliness, hand hygiene, hand sanitizers, gloves, you name it. We do use a local vendor, Constable Cleaners, and and they had just signed on at the top of the year last year. And boy, I don't think they knew what they were in for, but they've really met the challenge, and they're doing a really good job, along with our internal infection control monitoring and EOC rounds. Mandatory masking, hand hygiene, social distancing. The masking again became a moving target. What's the right kind of mask? Do I mask? Who gets to come in without a mask? And the vented mask. So oftentimes it felt like we were educating, enforcing, and it became a constant. And we really, really appreciate our patients for being understanding with what we were trying to accomplish. So testing and swabs, viral and antibodies, we purchase. So there's a lot of infrastructure changes that this doesn't even fully speak to. We purchased the LIAT system, which is a short for lab in a tube, to give us like the rapid resulting. And again, that's another evolution from sending specimens away, as far as I think in the Carolinas, at first waiting 3, 4, 5 days, sometimes 7 days. Did they get it? Did they not get it? To now we're able to provide rapid services, especially rapid resulting, especially in our urgent cares. The outdoor labs, we've done that, outdoor flu clinics, drive-throughs, the hospital teams, partnering with community members, supporting the community. Many of our pulmonologists have worked anywhere from Catskills to St. Luke's, and also partnering with our local 911 centers just to keep informed. Leveraging technology to automate telehealth versus no healthcare where possible. We really saw an explosion of telehealth. The things that we were able to accomplish to meet the needs and the demand of the times would have taken years, because we had been talking telehealth prior to the pandemic, and the pandemic hit, and the rest is history. Reassurance of safety for in-office visits following CDC's recommendation. Again, it's not a perfect system. I'd be lying if I was sitting here telling you we got this perfectly right all the times. We try to limit visitors, but there are situations. I remember standing there at the door, and some gentleman looked at me dead in the face, and he said, "Well, I'll be damned if you stop me, or somebody will be damned if you stop me from going in with my significant others." So again, just being flexible and trying to be exercising out of an abundance of caution, safety across the board, also limiting the amount of patients in the elevators, etc. Internal audits, we do monitor ourselves. We have, and I'll get to more on the other slide, and patient services, surveys, and response to feedback they share. We quickly implemented the cashless payments, which did hurt us somewhat, because more patients are comfortable paying in cash, and that was a decision out of safety not to be handling cash at this time. So as it pertains to staff, physical safety, policies and procedures, tons and tons of policies, as you can imagine. PPE, whether it's procurement, making sure we had what we need, how do we manage supplies, attestations. We have our internal processes of reporting should you become exposed, working with our employee health department, switching to virtual meetings, hybrid orientations. I've done several wonderful, I thought, interviews on Zoom, and just having to learn Zoom and that process, educating. We each were educating each other as we went along with it. Like, yeah, please, I can't see you, turn the the video on, but we're getting through this. Creation of internal, and one of the things I must mention, that CMEs travel, those sorts of things were also eliminated to not send somebody into harm's way. Creation of internal COVID-19 news and update resource page. And I always said, if the world could see where we started with that internal page and to what it has evolved to with all the links and access and services, it's amazing. Flexible and remote coverage where practicable. So non-essential within the building, staff in areas were moved to work remotely, including like the business office, some HR areas, and others. We now have patient services staff that works from home remotely, helping us with some of the check-in processes. Um, Practice-wide, Practice Matters and employee Q&A. Dr. Teitelbaum started having these almost like a virtual town hall for the whole entire practice, and it continues to this moment. It was more frequent, and now it's every other week, and it has been great. Employees are able to submit their questions and their concerns and get real-time answers. Managing furloughs, returns, and staffing support, just like many other businesses. Yes, we did have staff that were furloughed, and we had to manage that. It was really hard. It was great to bring people back and have them. The word repurposing came up a lot because people who formerly worked in one area returned to another that maybe had some staffing crisis, and just having to manage sick leave or people who did not have support for their children in order to work. So HR has really been focusing right now back on recruitment and retention and doing whatever is necessary to build our team. We have a phenomenal team, envy of many areas, and I'm sadly but happy to say if you get any of our staff, they're going to be terrific. I'd rather they not leave, but if you do get any of our staff, they're like diehards. Can't say enough about them. So focus on wellness and EAP, we started working with Vital Work Life, and that was across the board for physician staff alike because that part of it was real. We did a COVID memorial practice-wide just to recognize and acknowledge the feelings that we were going through and the lives lost. And you'll see a clip of that later on. And opportunities to address current events. We had things like everyday bias, tackling everyday bias. There's so much was going on politically, and I thought it was a smart decision to go ahead. Dr. Teitelbaum made the decision along with the executive team to address some of those things because it was bubbling up. We heard things like racism became more prevalent, whether it's, a patient coming in and people felt more free to express themselves. It was very worthwhile getting in touch with our inner thoughts and feelings on the subject. Celebrate and appreciate differently. Yes, we went from a time when we could eat and celebrate everything from a baby shower, somebody getting married, a birthday, to now how do we handle that while still recognizing that this is an essential part of sustaining us. The ANA, American Nurses Association, that I'm a member of, declared last year, 2020, the year of the nurse. Boy, was it the year of the nurse, and it's still the year of the nurse. It's continued into this year. So just a little bit about self-care. Again, continued employee assistance program if needed, not just for yourself, but for family members, managing stress, continued education. A lot of staff decided to use this time to pursue higher education. I have countless amount of medical assistants and nurses that are continuing their education. So maybe that was a good filling of the void, if you will, and useful a useful way to pass the time, or just for to end up with a better life. I guess is not a nice way of saying it, but as best as I could put it right now. Work-life balance is also very important. Having to make some tough decisions, maybe things that you would normally do, but you can't really do. But many of us felt like the days were longer than ever, really long. The weeks were really long. And it was pretty much, it felt like a time warp at times. Practice Wellness Committee, we have a practice-wide wellness committee. We have our wellness tips that we receive from HR just to help push us along. And we have local site wellness committees as well. Staying involved, again, differently, whatever you can. I know now in the era of Zooming, we can be having multiple meetings. So my staff meetings are held by Zoom, And so again, just managing those times and spaces. Promotes social distancing event. It's really hard to party and talk and eat while wearing your mask. So we have policies restricting that. And, I'm proud to say we did find a way to celebrate over the holidays without that usual food and gathering around food. And I thought it went well, and we just have to stay the course. Personal health maintenance. So it's not just our patients. We need to continue to receive our vaccines. The flu shots we've given, I want to say probably over 40,000 at this point. That's one of our quality measures, not just for our patients, but for our staff as well. And to make sure that we're staying healthy is, I know the slogan that, Crystal Run, we want you healthy, but yes, we want our staff healthy as well. So diet, exercise, and just doing everything you can. And I think Dr. T can say that part enough. So I just have some quick pictures to share. This is our initial tent by urgent care, where everybody couldn't really socially distance, as it was totally freezing and windy and everything that you can imagine with our propane heat. But they got through. We had several staff recognition and salutes. So they brought food with them, which was nice. And I feel like, when I went through the slides, I thought we worked really hard. We ate, we cried, we worked, we ate, we cried, rinse, repeat. Early nurses week of last year. I'm sorry, I think I made a mistake here. My apologies, I missed it. So this really is May of 2020, and I'll update that. I'm not that far into the future. I didn't see this yesterday. So this was actually last year's nurses week. Again, we were already elbow bumping, and grab and goes became a thing. This is a picture of Stacy in our outdoor lab. A picture of the practice-wide COVID-19 memorial in Rock Hill, and again, just trying to get through. But that I found was extremely, extremely moving. A picture of our new norm example, and yeah, while it may not always look like that, I mean, if you go back to the early slide with the amount of providers that we see in the building, multiple providers per suite, very few suites are germane to just one specialty, which would be like OBGYN or ophthalmology. So please keep that in mind. If you don't need to bring someone in with you, please do not. Those bubbles in the seats, don't sit on them. You see the 6 feet apart, and that will help us to maintain our social distancing as well. This is our current tent, all decked out with flooring and everything. And still it can be rough when you're on top of the hill in Rock Hill. And that was also the day Jamie came back in November for the Tyner community together. This is another view of that with Dr. Teitelbaum, and we have the bow, which I have to refresh in the main lobby. This is just another view of what got us through it all. The first responders from Sullivan County came to salute, as they did many areas, and this is us just, that's you, Dr. Ellsworth, with the tie and the blue shirt right there. So with that final slide, any questions? And I'll be happy to answer, and my contacts are included in the presentation.
Thank you so much, Joan, for that presentation. The theme, I think, is for us to have patience with one another, to practice good social distancing, and moving forward, if you find that your business, unfortunately, some of our smaller businesses do not have what Crystal Run has, with employee services. The chamber can certainly step in and help you find those services for your employees or for yourself. Should you have a need, we can help you find those resources that you need to help your business on a smaller scale. So thank you so much, Joan, for your presentation. Are there any questions? Okay, we're going to move right along to Jonathan Schiller from Garnet Health. Thank you so much for being here. Take it away, Jonathan.
Thank you. Good morning. And great job, Joan. Really, Joan, a lot of what Joan covered is very similar for the hospital and the hospitals and our health system. I'll just give a couple of minutes about our hospital, and then I'd like to transition into some nuts and bolts for things that we can do and things that we can take away. But if you're not aware, our hospital in Harris has been there for over 40 years, and our hospital in Callicoon has been in that location for over 50 years. This is our 50th anniversary in Callicoon. Just in terms of what we've seen over the past year, we had 35,000 emergency department visits to our two hospitals in Sullivan County, and a significant number of those were what Joan was referring to as patients or family members coming in for testing. And we were able to implement something similar to what Joan described, which is the rapid testing. And like everything during this pandemic, those testing cartridges and supplies are very hard to get. And please know that the community providers here in Sullivan County have worked tirelessly to make sure that we have adequate testing supplies for anyone and any patient who needs that testing. One of the unfortunate side effects of the pandemic is that we did have to significantly limit visitation of family members during the pandemic, and that exists up until today. But what it has helped us with is innovation, and something that Joan had mentioned with regard to telehealth. So two significant advances that I think are probably going to be here to stay for medicine. One is the use of telehealth and teleconsults, so that providers, wherever they may be located, can see a patient and, in conjunction with somebody at the patient's bedside, conduct an assessment and help make care recommendations for that patient. In addition, the other piece that I thought was very interesting is for patients who could not have visitors because of their COVID status, we were able to facilitate virtual visitation with family members. And it's similar to what we're doing today with Zoom and WebEx and GoToMeeting type events. And we did a little bit of FaceTime too. But that was a significant way to keep those patients and families connected as patients went through their course of treatment. And lastly, we wouldn't have been able to be as successful as we have been in the past year without all the community support that we've received. It's truly humbling to see the amount of support we've received from individuals, organizations, community groups, and businesses in the community. I want to just have a quick word on vaccines, and then I'll turn to some true nuts and bolts type information that may be helpful. And I know Dr. Ellsworth will have more clinical information for you with regard to vaccines. But in our hospital in Harris, we've administered over 3,500 vaccines. I myself was vaccinated. One of the last employees to do so. I wanted to have all our employees go first. But please know that the vaccines are exceedingly safe. And although it was a accelerated approval process, the review is the review. And the scientists who are involved in these reviews really aren't politicians. They're born and bred and have been doing this work for decades, and they live for this moment. This is their Super Bowl, and they've just performed outstandingly well. And so we're firm supporters of vaccination where appropriate. Two vaccines have been approved. One is in the current review by the FDA for emergency use authorization, and we've administered both of the approved vaccines in our hospital. If you're unsure about whether or not you should be vaccinated, consult your physician. Don't make that decision independently. Garnet Health, we support vaccination and we support informed vaccination. So if you have questions or concerns, consult with your physician. Please don't consult with Dr. Google, because Dr. Google, if you search hard enough, you'll find the answer you're looking for. And no one knows you and your health history like your physician or your nurse practitioner does. And we are strong advocates for vaccines being available in doctor's offices like Crystal Run or like Middletown Medical, and as well as pharmacies, public health departments, and of course hospitals. We think that one of the pathways out of this pandemic for us is ensuring multiple access points for members of our community to be vaccinated if they choose. So just a few nuts and bolts comments about workplaces, and we've implemented these as well. But one of the things I want to mention is for each of us as leaders, if you own a business or you're leading a business, this is a time to talk to our staff about personal responsibility. In our culture and in our country, we sort of have this badge of honor. I'm a little bit sick, but I'm coming in work because I'm tough and I can do it and I can make it. And it's just a little cough or what have you. Times have changed, and we need to lead with reminding our staff about being responsible and acting responsible and not putting others at risk if they may not be well. Stay home, and that's the new badge of honor, is being honest with yourself. And like Joan had said, focusing on your own wellness and making sure that you're ready to go back to work. New York State has implemented a 50% occupancy for business functions and business locations. There's a lot more information for that on the New York State's website. And one of the ways that we've been able to accomplish this is using flexible hours, flexible days, flexible schedules, virtual meetings where possible, et cetera. We have worked with a couple of businesses that I thought was interesting. One of the approaches they did, they had shift work, and they broke each shift down into an A team and a B team. And that way, if somebody on one of the teams, A or B, became ill, they didn't expose the entire other team, and they switched teams every other week. It was an interesting approach, and seems to have worked well. Please encourage your employees to be very thoughtful and very careful if they're going to be traveling, and please do the same for your own employees in terms of business travel. But the CDC quarantine recommendation right now is 10 days after travel if there's no signs or symptoms, 7 days if there's a negative test result. New York State is adopting these and will probably get more and more aggressive as the science continues to become clear over time. Please lead by example, wear a mask. They're very fashionable. You can get all kinds of different masks in different colors. I saw some Valentine's masks last week. They were cute, but it's not that hard to do. They're very inexpensive. And make it a fun game if you can at work. Who has the most creative mask? Certainly a fun thing to do. If you're interested and you have the capacity, it might not be harmful to check your staff temperatures if it's possible, or ask your staff to check their temperatures before they come into work. One of the things that we thought was interesting and we performed, and there's no cost to this, is conducted a hazards assessment to determine what current work practices might put your staff or your customers at risk. And the CDC on their website does have a very helpful hazardous assessment tool. And it's just a very methodical process to go through things that we wouldn't normally think of in terms of where people queue up, bottlenecks and people movement, if you will, and the flow of an organization. An easy area to miss is contractors. So if you have any contractors coming on site, please make sure they're aware of what your policies are and what your expectations are. And it only takes one, right, to create a problem for the whole organization. So please review with your contractors before they come on site. Let them know how you conduct your business and how you keep your employees and your customers safe. Joan had mentioned moving to electronic payment. A real easy thing to do. And in this day and age, people are paying with their phones, with their cards, with just about everything. And I think the younger generations look at cash as an inconvenience. I know my kids do. And then the last piece I have is something that, again, we're all trained when we're little kids. Wash our hands, wash them the right way, and perform routine cleaning and disinfection. Again, not hard to do, but it takes discipline, right? How many times can we wipe down the same countertop? But it takes discipline, and it's very inexpensive thing to do. And then the last piece I'll touch on before I turn it back over to Jamie is about our customers. One-way flow in the workplace of business wherever possible. And like Joan had indicated, limiting seating in waiting rooms if you have a waiting room, or limiting seating in break rooms if you have break rooms for your staff. And put that right on the door. Maximum seating is this. So everyone who enters the room and everyone who works there understands what the rules are. Visible social distancing signs where possible, and signage on the doors about masking and what your expectations are. One of the things that we've noticed is in our own organization is that when we have the appropriate signage and we're leading by example, our customers, or in some cases our patients, feel more safe, and they know that we're taking this seriously, and your customers will know that you're taking it seriously if you have the visible signage and markings around. And a big part of being safe is feeling safe. Low cost hand sanitizer, make it available wherever you can. And again, like I had said, limit capacity. So these things, none of them individually are that hard or that complicated, What they do take is that stick-to-itiveness, if you will. They take a little bit of discipline and constant reminders for our staff and people that we work with about what our expectations are. And it's easy to let our guard down when our positivity rate in our community is low, but the way to keep it low is to exercise that discipline and that dedication to the safe practices. So those were my opening comments that I have. I'll turn it over to Jamie, but I'd be happy to take any questions.
One of the questions that was asked was where can our businesses find best practice information on how to establish and maintain a safe environment for customers and employees alike? It's a great question. Thank you, Heinrich. For everybody involved, the best place to go first is www.newyork.gov, and I have that in the chat area. They have specific guidelines for most, if not all, industries located in New York. And our website, catskills.com, has a more user-friendly version of that same document and that same guideline protocols and so forth. So visit our website and newyork.gov to find out those specific guidelines for your industry. Thank you so much, Jonathan. Really great job. And moving forward, I'd like to introduce Dr. Ellsworth. I'm sorry, I pronounced your name wrong.
That's okay.
Forgive me.
For dinner, I'm fine. Good morning, everyone. Ellsworth. I'm a family doctor with Crystal Run Healthcare, and I'm the medical director of Sullivan County Public Health Services. And as you know, we have an incredible team led by Nancy McGraw and Wendy and Karen and Jenna in the process of distributing the vaccine to our population. We have each day that we've received vaccine, we've been able to distribute it to the essential workers, to the 1A and 1B categories, which include essential workers, frontline workers, and citizens over 65. We do have limited supplies, but we've managed to give out everything that we've received, up to 300 doses in a day. We've partnered with Garnet Health in distributing the vaccines and determining where the greatest needs are, as well as educating the population in Sullivan County about the need for vaccination. I can't emphasize enough the importance of, regardless of whether you receive the vaccine or not, that you need to do the social distancing, the mask wearing, and the hand washing. Even with the vaccine, it's possible to harbor the virus asymptomatically in your nasal passages and to share it with other people, even though you may not get ill from it. Becoming educated as to the status of the disease in our county is important as well. And using the county website and going to public health, you can see the daily numbers as far as the numbers of cases, the numbers of testing, and the number of people that are in the hospital. Fortunately, we've seen a downtick in the number of infections in our county, but this should not lead to complacency among the people that we serve, and certainly we should not be letting our guard down in our contact with our patients and our clients and customers in the businesses throughout the county. Being careful is critical. Maintaining social distancing, and in this case, in the principles of ethics, social justice, doing the best we can for everyone really should trump autonomy. As mentioned before, we are people that stress our independence and our autonomy, but we need to take care of our families, our friends, and the other people in our community. And this is where taking care of all of us means getting the vaccine. The vaccine, as Jonathan mentioned, is safe. There are very, very, very few side effects. I've received both doses, and the only annoying thing I had was a sore arm. And I do encourage people to get their vaccines as they become available and when their qualifications meet when they're qualified to get the vaccine by the criteria listed by the Department of Health and the CDC. We will continue to provide vaccine as it becomes available to those people in the community. Other resources now are the pharmacies, as mentioned above and before, rather. The pharmacies have it. Crystal Run will be having it, and certainly Garnet has been distributing the vaccine as they have had it as well. Other community organizations such as the Center for Discovery has been distributing a vaccine to their clients, and ARC to their clients as well. And I do not have any other specific data from public health as far as the number of vaccines we have at this point. We hope to get a shipment today for distribution tomorrow and Friday. We will be moving our vaccine distribution center from the community lane office to the college in March and using the field house. So if anyone qualifies, please use the website to register, and we will contact you when the vaccine is available, and we'll get you in to get your vaccination starting in March at the college in the field house. I'll gladly field any questions that you have.
Thank you so much, Dr. Ellsworth. I'm sorry about the mispronunciation of your name at the beginning. I have a question for you, and I have a question for all our presenters. We, as a Chamber of Commerce, advocating for our business community, and we have had the discussion of how can we advocate for fair and equitable distribution of the vaccination, and how can we advocate for our Sullivan County residents at the state level, perhaps, or, you know, with our representatives in government to get more vaccinations here to accommodate our population. Not that we have a large population, but we are rural, and I think we sometimes get the short end of the stick here.
Certainly, we need to advocate for providing the best possible healthcare to all of our citizens, and we do have a fairly substantial underserved population in the county, and Sun River Health has also been a partner in distributing vaccines as well. And certainly our underserved population is not undeserved, and we need to have as much outreach as we can to identify the needy population, to educate people who have reticence toward getting the vaccine for a variety of reasons, and some of those involve history of discrimination in the past, and we need to educate the population that it is safe and make it available.
Oh, we lost you, Dr. Ellsworth. We lost your audio. Dr. Ellsworth, we lost your audio. We can't hear you.
While Dr. Ellsworth recovers his audio, I just can't
Thank you, Joan.
emphasize enough the article. I can't or will not even attempt to go into the extent of it, but please look it up. Times Herald Record. Dr. Tattlebaum spoke extensively about the struggles and frustrations of practices like Crystal Run being unable to provide this dire need to our patients and customers. So it's not for lack of advocacy on our part, but it really needs to be amped up. So yeah.
There's one other comment about how to advocate. Our elected officials at the state level, Assemblymember Gunther and Senator Martucci are very supportive of the vaccination efforts. And the more people they hear from, the stronger their advocacy will be. When the New York State Public Health Department looks to set up vaccine centers, one of the things they look at is population density. Where can they administer the most in the least amount of time, and that type of thing. However, our county, because of the rural nature of where we live and the socioeconomic status indicators that we have in our community, we're really good candidates for New York State Department of Health mobile vaccination options. And so please reach out to our elected officials. They do need to hear from everyone, business owners, private citizens, so that they can appreciate how important this is to everybody.
Thank you, Jonathan.
I'm sorry, I lost the audio and we froze up there for a bit.
There we
so
go.
Don't know if anything I said came through.
We missed the last part of what you were saying.
And I don't know.
We're missing it again. I'm so sorry, Dr. Ellsworth. We're missing it again. I'm so sorry, Dr. Ellsworth. Technology is great when it works. I want to encourage everybody to follow the Chamber of Commerce. We are going to be advocating in a more aggressive way, assertive way, I should say, in the next few days, especially for more vaccinations being distributed to the Sullivan County area, especially for our underserved population here. Are there any other questions from anybody? I know Joan has put some questions in the chat area. I actually put them in for her. If you want to, you can answer those in the chat area. And Heinrich, would you like to say a few words?
One other comment, I don't know if you can hear me now.
Yes.
Is that the vaccine is free, as everyone should know. So there is no charge for it when it's distributed to the population.
Terrific. Thank you.
Sorry, Jamie. It took me a minute to unmute. Technology is my limitation as well. Before I say anything, there's a question I see in the chat from Brewster about antibody tests being available at Callicoon Hospital. And if so, what is the cost per test if he wanted to every employee to get one before returning to work? I think that's a good question as we come out of the winter pause for many businesses, and they are gearing up to reopen for the season. They certainly want to make sure that their employees are properly tested before they return to work. Yeah, Callicoon Hospital is a local resource. I think we have other stations as well, but availability of tests, I think, is the question there. And it's antibody tests, I think, not only swab tests. I'm not quite sure if there's a difference in the procedure.
I can, thank you, Heinrich. I can help answer that. The short answer is yes. So the swab tests are available in Callicoon for any patient who presents to the hospital emergency room. The antibody tests are available. It's an outpatient lab draw. Like any lab draw in New York State, it does need to be ordered by a provider, physician, nurse practitioner, physician assistant, who's licensed in the state of New York. And those tests, those lab specimens can be drawn in our Callicoon location, processed and resulted. It takes about a day or so for the antibody testing. The cost for it, it depends on insurance coverage or if someone prefers to pay privately. So if you're looking to do antibody testing for your entire employee base and want to pay privately for that, that would be a conversation we can have offline. But in terms of is the test available, the short answer is yes.
And ditto.
There's also a question about reliability of antibody testing. The PCR test is the most reliable. That's the nasal test. And the antibodies, even if you've had the disease, the antibodies may only last for up to 90 days in your body. And the test has not been shown to be 100% reliable, so I don't put much store in depending on that test as a criterion for returning to work. Also,
So the safer really is, sorry, the safer really is the PCP.
The PCR test is the most reliable test, and it, unfortunately, some people will harbor the virus in their nasal passages, which will give them a positive PCR test, even though they're no longer ill. So many people are not advocating for doing a follow-up PCR test in order. There's a fair amount of controversy about this, although it does speak to the fact that the virus is present in the nasal passages. I would rely on the criterion set by the CDC and the Department of Health as far as the number of days that you need to be in isolation following a positive diagnosis, and the lack of symptoms and the lack of fever. And that has been determined to be the criterion for the safe return to work. And also, just to emphasize again, even though you had a negative test or you followed the rules and you were isolated or quarantined, depending on whether you had a disease or not, you still need to exercise all of the precautions, including mask wearing, hand washing, and social distancing.
And I just want to add, and that's part of the screening fatigue, if you will. Patients, some patients who feel, or some industries who feel they test weekly, or even if you were testing daily, it's not a it's not a shield for exposure. So we continue to screen at the door, and I know it's frustrating, and they're over being asked all these questions over and over again. But being tested solely is not a prevention from having it. Even people who are have received the vaccines still will be practicing the same, continuing to wear your mask, hand washing, social distancing, because we just don't know everything. I can't say it enough. You've heard about the various strains that are now being shared, 7. We just don't know. It's a moving target, and we just still have to keep whatever is in our controls, within our controls, and try to mitigate what's yet to come.
Also, if you feel ill and if you have any symptoms at all, even with a negative test, you should not go to work. You should not be in contact with other people, because some people may be ill for several days before the test will turn positive, before they have the presence of the virus in their nasal passages. So that exercising extreme caution with anyone with symptoms, fever, respiratory symptoms, is critical.
We have one more question. What is the status on vaccinations? How many are we achieving per week, month, and when can we find out when it's going to be our turn?
Well, this is Jonathan. I can help with part of that answer, and part of it is a little bit unknown. So the countywide numbers are somewhere between 5,000 and 6,000 right now. Our public health department does track that information closely. As Dr. Ellsworth mentioned, multiple sites are vaccinating, and more will be each coming week. So the number continues to grow every day and every week. In terms of when will someone know that it's their turn, New York State has developed a website that's called the New York State Am I Eligible website. If you go to the web and just Google that, it'll come up. And it provides, it asks a few simple questions and provides someone with the information about whether or not they're eligible yet. The CDC has promulgated a fairly thorough set of groupings in terms of when a particular group or individual would be eligible for vaccination. And that list probably has about 75 different classifications on it. It's too much to go over here, but if you're interested, you can go on the CDC's website, pull that down, or the New York State Department of Health's website, pull that down, and you'll see where you may fit in the grouping. Generally speaking, people with comorbidities and over 65 are eligible. People with comorbidities and under 65 are eligible. But if you have no comorbidities, 65 is the cutoff at this point.
Now, I personally, I have comorbidities, and I went to make an appointment like they instructed us to at the NewYork.gov website, and I got on there, and there were no appointments locally. I had to make an appointment up in Binghamton, and that I couldn't even get in for most of the day. I managed to get an appointment, but that's 2 hours away. Is there going to be more vaccination sites in Sullivan County?
That is a significant part of the frustration of many people across New York State and other states as well, where the supply that we're receiving as a state and as a region is significantly below the demand that exists. And so it's disappointing that you and thousands and thousands and thousands of other people have that same experience. Ideally, like Joan had said, Crystal Run has registered and is approved. Many of the pharmacies in the community are registered and approved. I don't think there's anyone's fault here, other than to say that there's just simply not enough vaccine to go around. And the issue of equity does play into there. And perhaps that's something that the state needs to look even harder at. But ideally, over the next couple of months, more and more sites will come online and have vaccine. Just because we're open, like Garnet Health Catskills is, we had enough vaccine to run our clinic for one day this week. So it's certainly a scarcity issue for sure.
Okay. Thank you,
And
Jonathan.
it's the same with public health. As we get the vaccine, we open the doors to the people who have signed up and registered.
Terrific. Thank you so much. Well, I really appreciate everybody being here. Sullivan Renaissance did put in the chat, and just for everybody's information, they do have grants available for businesses that are looking to maybe have outdoor seating to encourage social distancing, to accommodate your customers. So please check out Sullivan Renaissance. I'll have them put their contact information in the chat room before we leave. And you can contact the Chamber of Commerce at catskills.com or 845-791-4200. And we can direct you to Sullivan Renaissance or to Crystal Run or to Garnet Health, or answer any of your questions of where to find more information regarding your particular business or your particular situation. I want to reiterate something else that I put into the chat. We have a limited supply of masks to give out for free to small businesses with 10 employees or less. So if you have a need for masks, please contact our office and we will make an appointment for you to come pick them up. Thank you so much for attending, and thank you so much to our presenters. We really appreciate you all joining us. I will send out a recording. Actually, we're going to place this recording of this webinar on our website, and as soon as I have the recording ready to go and the chat notes, I will put that on our website and send you a link to so you can view it. Thank you again to everybody. Have a wonderful day. Stay safe, stay well.
Thank you.
Thank you very much.
Thank you.
Keep up the good work.
Thanks, Jamie.